the beauty starts here and in here. And how it manifests in our physical appearance, it is a byproduct of what you start with in your heart and in your mind.
And I like that through all three of these, you're beautiful, you're unique, you're worth it. You're programming people for happiness. You make them feel good. Integrative lifestyle, integrative medicine, integrative healthcare component is also very important, because what are you doing in between to preserve that beauty?
The world can only be more beautiful if people are happier too. Everybody is all about going to a professional, getting a treatment, looking and feeling better, and that's the end of that. But what are you doing the other weeks and months between your visits? Are you optimizing your diet? Are you taking care of your health in other ways?
Today, we're going to talk about the art of facial plastic surgery. And that's really important to approach from a slightly different angle, because it's not really about the mechanics to make people look more beautiful only. It's really about the artistry and helping people understand, appreciate, and express their unique beauty. Plastic surgery can be sometimes a solution to a much deeper problem, an emotional problem. And that's why understanding of a patient, deeper communications with the patient, compassionate care, they matter much more in plastic surgery than people think. It's also really important to practice integrative approach to healthcare, including plastic surgery, because you can always collaborate with other providers. You can always integrate different types of services, different types of ways to support the patient. And that's why I'm very happy to introduce to you our very special guest, because he does it all. And he's actually one of the top facial plastic surgeons in the country, and very likely one of the top facial plastic surgeons in the world. His name is Dr. Jae Kim. He is working with great passion for enhancing unique natural beauty and restoring confidence. His list of accomplishments is really very, very long. I'm going to put some information in the show notes so you can look at the details, but it ranges all the way from his undergraduate degree at Harvard University, all the way to becoming a double board certified plastic surgeon. Also supporting his peers and his community by educating others on his mission to make the world a more beautiful place. As he always says, starting with you. Mm-hmm. I'm here with Dr. Jae Kim. Welcome to Polish Your Life.
Thank you for having me, Mike. Really humbled, glad to be here, excited to talk all things artistry, facial plastic surgery, making the world a more beautiful place.
Fantastic. So let's talk about your mission. What does it really mean to you so people can understand your perspective?
Yeah, my mission as a double board certified facial plastic surgeon is to make the world a more beautiful place, starting with you. To elaborate on this further, I have 3 core tenets that I outline with every patient and in every aspect of my practice. The first is that you are beautiful. This is what a lot of people don't start out with, is the idea that they are already beautiful. And this is very critical, because if you don't have the mindset of, oh, I'm beautiful and I want to achieve a more beautiful version of me, then there's no foundation. And without a foundation, you cannot achieve good results. So that's the first core tenet, is that you are beautiful. The second is that you are unique. And there has never been, or there never will be, anyone beautiful like you are. And so the uniqueness of us as individuals, as humans, that's really what it comes down to when it comes to being on a journey, a mission to make the world a more beautiful place. And the third is that you are worth it. Each journey can have ups and downs. There can be effort. There can be, some bumps in the road. It can be a process, much like other aspects of our health, let's say, such as exercise. Every day is a process. You have to show up. And you show up because you believe that the journey is worth it and that you are worth it. So those are the 3 core tenets of my practice.
I love that. And it means a lot to people to understand that when they are coming to your practice to make them more beautiful, they need to realize that inner beauty. that outer beauty as well, because in a sense everybody really is beautiful, and it's just a matter of our mindset. So I wanted to ask you, because we, outside of this interview, we talked quite a bit about mindset and also in patient care, how important it is to have a proper approach. So let me know the importance, from your perspective, the importance of mindset and what mistakes people make when it comes to self-judgment.
Yeah, I mean, this could be a show in and of itself, just in terms of our misconceptions coming into starting a beauty journey. Um, you know, the thing about our beauty is that we have so many messages from the outside world that are hurtful or downright wrong. And, it starts with, let's say, we kind of, our formative years were kind of in the 90s. And so you saw people like Kate Moss, who were the standard of beauty. And if you weren't stick thin, if you weren't blonde, if you weren't 5'10", you were considered not beautiful. And so that's, one of the big lies that we have in our society. And it continues to this day, and even more so because of social media and the internet, is that it's always here, this wrong and not constructive message that, oh, this is the standard of beauty that you should emulate. When in fact, it's the other way around, that the beauty starts here and in here. And how it manifests in our physical appearance, it is a byproduct of what you start with in your heart and in your mind.
So this is very important. And at the same time, I see that there may be a big challenge, because in practicality, you have a patient who walks in the office and they say, I need to be evaluated for a specific procedure. And now I'm thinking about the challenge that you and your team may have. How do we actually communicate what you just communicated to me without making it kind of like derailing the conversation? Because if people are coming for rhinoplasty, for example, or any other procedure, they want to have answers to frequently asked questions. How much does it cost? What does it take? The downtime and all that stuff. And now the office starts asking questions that may be considered a little bit beyond their expertise, right? Because it's more like, I don't want to go towards like it's like therapeutic experience, but it's a little bit more like a coaching and getting to the underlying reason for the surgery and what outcomes they're really trying to look for. So how do you bridge the gap between just answering questions that they have and also giving them the knowledge that they should have about their inner beauty and motivating them to actually express the inner beauty that you see in them?
Yeah. So, like you said, there are questions that everybody wants the answers to, like downtime, cost, risks, benefits, things like that. And I try to make as much online content as possible so that they see that before they ever come to my office. Now, since everybody's beauty is unique, there is still some element of discussion there regarding the actual procedure, regarding their pre-op and post-op process. One of the questions that we ask that helps to break the ice from the usual stuff that we talk about into the deeper, more personal stuff is, what motivated you to seek out this change for your beauty, for your appearance? And sometimes they'll say, "Oh, I get teased at school or at work." If it's a younger person who is unhappy about their nose, usually there's some amount of outside influence from other kids at school, or a self-conscious issue of, oh, my nose looks weird, or my ears stick out, or stuff like that. And but for others, let's say for people who have been through more of life, some people say, oh, I'm an empty nester now, or, oh, I went through a divorce. There was some kind of major event in their life that changed how they think about their appearance, and they say, oh, I'd been holding this off for so long, like it wasn't a priority. And then after this happened, now it's more on my mind and I want to do something about it. So that's how the conversation starts. We want to make sure that the motivation for pursuing plastic surgery or starting the beauty journey to achieve a more beautiful version of you it comes from a good place. Because if it comes from a toxic place, or if you're doing it for somebody else's benefit or pleasure, it's not going to end in a good spot. So it has to come from you and it has to be for you. If you're doing it for someone else, you're never going to achieve the standard that they're looking for because they're always going to move the goalpost. You know what I mean?
Yeah.
There was a young patient of mine who sought out double eyelid surgery. And it's one of the most common procedures that I do. And I'm one of the few plastic surgeons along the East Coast who does as many as I do. And so this person, she has three young kids, and she's a young mom and she's pretty, and she wanted double eyelid surgery. And afterwards, maybe 4 or 6 months later, and she had a great result, objectively speaking. And yet we were the main point of conversation in our post-surgical visits is, oh, I'm not happy. And so I have to dig a little deeper into, oh, why are you not happy? What's going on? And she says that there are people in her life who said, oh, why did you do it? Why did you
After the surgery, she was not
after the
happy.
fact?
Oh, okay.
Yeah.
Okay.
Yeah. And so I had to dig a little deeper to see whether it was other people's actions or words that were making her unhappy, or whether it was her thoughts herself that were making her unhappy. And from the looks of it, it seemed like it was more the former, that other people in her life whose opinions may be of value to her to some degree were saying, oh, why did you have double eyelid surgery? You look different. Ironically, those are probably the same people who say, what's wrong with your monolid? You should do it beforehand. You know what I mean? So, yeah, having a healthy place to start your beauty journey is so crucial in achieving success.
Yeah. And I'm trying to think, we always have, all of us, we have this outside world, the world around us, and we also have this internal world that sometimes we keep to ourselves only, sometimes we share with the closest people to us. And the outside world does affect the inner world. And at the same time, for people, it may be a big challenge when they come to a plastic surgery office and they receive a question from you that they didn't expect, that asks for the key to the door to the inside world. Do you see that most people actually give you that key and have an open conversation, or most people that becomes really challenging for you to connect with them?
Most people are mature enough to open that door
Okay.
when I present the situation. So to that extent, I feel like they're mentally, emotionally there in terms of, hey, I want to start this beauty journey, and I know that there's a semblance of beauty there that I want to restore or enhance or rejuvenate. So usually that conversation goes pretty well. And there are some, regardless of age, who have not thought about this and who are, I guess, for want of a better word, emotionally immature
Mm-hmm.
about their motivation um, to pursue this change in their appearance. So with them, the conversation might be a little more basic. You know, let's say like a teenager who wants a rhinoplasty, for example. Often they come with a parent or both, and so it sometimes you have to distill the conversation down to you and the patient. As much as the input from the parents is helpful, you want to know, hey, you want to remind the patient, 16, 17, 18 years old, hey, this is your nose. Your parents brought you here, but someday your parents are not going to be there when you have this new nose of yours. So that gets the conversation started.
What an important point to discuss, because that patient, 16-year-old today, will be 26 in 10 years. And really remembering that they were treated with respect and you were treating them like an adult at that moment, and that decision has some consequences for the future. I really like it that you are allowing that conversation, and the focal point should be really the patient, not the parents, because it's all about our lives. And like you mentioned, if I have a broken nose, and I do, that nose travels with me, right? So if I fixed it when I was younger, it would also travel with me, and that decision should not be just my parents, it should also be mine. So I think it's very, very important. You mentioned that beauty journey. So that's something that has been in our conversations, really important. And at the same time, this is something that I think a lot of people don't understand, because sometimes you're coming in to fix a problem, nose, eyelids, whatever the problem, double chin, whatever the problem may be. But the beauty process is a journey, and there's the external component that you support with the mechanics of plastic surgery. There's also the artistry around it, because it needs to be done with precision, and it needs to be done the way that makes the results very natural. And there is also this component of having a beauty plan. So I wanted to ask you to explain to our listeners and viewers, what exactly is the beauty plan? Because somebody comes in and usually they will request or inquire about one procedure. And from your perspective, you are more strategic about it and you want them to consider a plan. So let's talk about that aspect.
Yeah. So, like you said, a lot of times people come with a concern about a specific area of their face or neck. And I tell this to people, especially who have like issues with upper eyelids or lower eyelids. Hey, we know we're taking care of the eyelid bags this time around for surgery, but somewhere down the line, you might want the extra skin off the upper eyelids too. So it's looking as specific as their concern is. It's kind of zooming out to the entire gestalt of your face and neck to say, what's the best way to have a complete package approach? And so some of that involves surgery with what I do. Some of it involves, injections, like aesthetic injections. Commonly, we do Botox, we do fillers, and also in terms of skincare, right? We have a wonderful master esthetician who is a specialist in skincare related procedures and really tailoring your skincare regimen. So just anatomically, there are multiple layers of beauty that we need to work on to achieve the best result possible. If you think about a car, I think about it in the way that the surgeon works on the engine, the transmission, the chassis, things like that. But if you don't have a car wash every now and then, your car's not going to appear the most beautiful version of itself. Likewise,
Sure.
when I do surgery, oftentimes the same patients go for aesthetic injections with our injector and also for skincare procedures with our master esthetician. So there's multiple levels of this beauty journey. And sorry to throw all these analogies, but if you look at a swimming pool, right, the deep end is the surgical part. The wading pool, the 3-foot area, the 5-foot area, those are the non-surgical aesthetic treatments that a lot of our patients undergo to help the maintenance of their beauty. Your beauty in your 20s and your 30s is different than your beauty in your 50s and your 60s. So not just in that timestamp are you looking at a multifaceted approach to your beauty journey, but over the decades, you're looking at different changes to that approach as well. So in all of those respects, it's really about a journey.
So how do we swim? We talk about this swimming pool that has the deep end and it has the shallow end. And my understanding is that both may be needed, right? So the person should be swimming, a little bit in the deep end, a little bit in the more shallow water. So what is, if there is a fight against time and the effects of time on human body, and in your case, face, what is the proper approach? Should people jump in the deep end, meaning have surgery first, and then go to the shallow end and do some cosmetic procedures along with injections and non-surgical? Or should people actually start from the shallow end, start with injectables, skincare routines and things that are non-surgical, and then go to deep end? What's the better approach, or is it always case by case?
Most people are more comfortable with the shallow end first. And so the beauty journey starts with a skincare treatment or with a Botox injection treatment. Rarely, well, I guess less commonly, people go surgery and only surgery, and then they'll never come back for a non-surgical maintenance cosmetic treatment. And to that effect, their result is, not 100% of what it could be. But for most of our patients, it starts off with a non-surgical. I think because, number one is a cost factor.
Mm-hmm.
Usually surgery procedures are more expensive than non-surgical. The second one is there's a perceived notion that recovery time takes longer for surgical patients than for non-surgical, which most of the time is true. And then there's also the concern of with surgery, there's not an incremental change to your appearance. It's a stair step, right?
Right, right.
One day you look like this, the next day you look like that. And so to that effect, most people are not psychologically ready for that compared to a gradual improvement in their skin, a gradual improvement in their wrinkles, things like that.
Makes a lot of sense, because if the outcome is amazing, I think it's it's just a little bit of getting used to, and then they basically come with a big hug to your office. But it could be a shock factor, right? Because you actually see a different person in the mirror. So emotionally, I can see how that is something that can really be challenging for some people, especially people who really have that self-confidence on a very low level. I wanted to go to one area emotionally that a lot of people reside in, that you mentioned that would be something that actually is very problematic when it comes to accepting them as patient, and that is body dysmorphia. So
Yeah.
let's talk about that, because I think there are some people who may have elements of it, but not really the full condition. But I want people to understand, why would a plastic surgeon not perform a surgery when the procedure is requested?
Yeah. So actually, we have very good content on YouTube about body dysmorphia. The concrete definition of body dysmorphic disorder is intense fixation on a perceived flaw of your appearance. So it could be, if my nose were grossly misshapen and I were concerned about it, that wouldn't necessarily qualify as body dysmorphia. But let's say if I were concerned about a zero point 0.5 millimeter difference in the size of my left nostril compared to my right, and if I were looking at it in the mirror all day, every day, and would not leave my house, that is a textbook definition.
Mm,
So some people, their presentation of body dysmorphia is not so overt. And we notice that, body dysmorphic disorder runs with other mood disorder type, personality disorder type manifestations. And one of the common things that we see along with body dysmorphic disorder is obsessive compulsive disorder. So, you check if you locked your car 10 times. You checked if you, turned off all the gas burners on your kitchen stove 20 times, things like that. Body dysmorphic disorder is you get caught up in your own kind of rabbit hole in terms of, oh, because of this flaw of my appearance, because of this slight asymmetry of my appearance, nobody likes me. I don't want to put myself out there in the world. I don't want to go to work. I don't want to go to sleep. I don't want to do anything. So you're trapped in your own mind about your appearance and how you think that people see you. So you're trapped in your own mind about your appearance and how you think people see you. When that happens, many, many people seek out a change to their appearance. So they see people like me. There are some situations where the doctor or the provider will not catch that issue, that underlying issue of poor self image. And if you perform a treatment for this person. Let's say, sometimes it can be a surgery, or it can be even a skincare treatment or a Botox injection. What will happen is they will have that same fixation along the healing process after the treatment. They'll never be satisfied in terms of the outcome, in terms of the journey to get to that outcome. And so they'll move on to the next cosmetic surgeon or the next Botox injector. And it's just an endless cycle of never being happy with the person or with your result, and never being happy with your own appearance. So it's very dangerous. And in the most extreme sense, you can have somebody who is so caught up in their own dissatisfaction of their appearance that they can harm themselves. And so that's what you don't want. You want to have a mental health professional, a psychiatrist, a psychologist, somebody who will see them and, evaluate and treat according to their psychiatric needs.
Yeah, and I feel so sorry for people who suffer because the world that they experience may not be the real world, of course, but it's based on how they feel about themselves, which may not even be true and most likely is not true. And sometimes it can get to the point where there's no solution, because no matter what you do, you still find something. What you're looking for, you will find. And the problem is, when you're looking for flaws, there's plenty of them around us and within us as well. So I think the calibration of mindset is something that can help a lot. And when it's outside of the scope of your practice, like you mentioned, you would refer to a provider who can support. And that's the beauty of integrative healthcare mindset, because people need to understand that it may not be obvious that somebody goes to a plastic surgery office and then they get not diagnosed, because that's not your job to diagnose them with body dysmorphia, but you can see some warning signs, some red flags or yellow flags, and you may want to evaluate, not do the procedure, and sometimes refer to another provider, and who knows, maybe save somebody's life. And I think that's very important, because it's not really about doing things like an assembly line that somebody requests a procedure, so we should do the procedure, but really seeing what's the best for that patient. And that's why I really, really appreciate you looking from the mindset perspective and the artistry much more than just the mechanics of it.
Mm-hmm.
The opposite of this is also very true and actually very optimistic, because what are you telling people all the time? What do you tell them? You are
Yeah.
beautiful, you're unique, you're worth it. So you're programming people to actually look for signs of what you are showing them and what you're telling them. So now they actually recognize it within themselves that they are beautiful, they are unique, they're worth it. And I think you're doing much more than just optimizing for the next procedure and helping them on the beauty journey. You're actually helping them be more happy in life,
Mm-hmm.
because there's the benefit of a plastic surgery that I would argue is probably even more important than the visual outcome, is how people feel after that surgery. Because if they actually feel they did something they wanted to do, they see the change, and now they can take care of themselves and look in their mirror and see their new nose or new appearance and be very happy about it, and actually appreciate, and now seeing, maybe Dr. Kim was right, maybe I am
Mm-hmm.
beautiful, and I see the
Mm-hmm.
signs of it. So I think it's important for people to understand it's not about marketing slogans or anything that is on the website that just sounds good and pretty. There is the underlying reason why you have your mission, why
Mm-hmm.
you talk about these three simple truths that are much deeper when people know you, much deeper than it may seem on the outside. There is a meaning behind every single one of these.
Yeah,
And
absolutely.
I would
Mm-hmm.
like to also touch on something that I found very interesting. And I heard you say at some point, bring a picture of yourself when you were younger. If
Mm-hmm.
somebody wants to have a procedure, why would you ask somebody to bring their own picture?
One of the big reasons that I ask for that is so that I can get a read on what they found to be beautiful in that picture. And so, whether you're looking back 20, 30 years ago to your young adulthood, or even if you're looking in front of the mirror currently, hey, tell me something about your appearance that you find beautiful. That's a very easy way for me to gauge, hey, does this person see beauty in themselves?
Mm.
Because that's very important for a successful outcome
It
in
may
their
be the
beauty
first time
journey.
anybody asked them this question.
Exactly.
So what about the natural? Because people ask you, I want natural results. I want to have surgery, but don't want people to necessarily obviously see that there was a major procedure done. So
Mhm.
how having a picture, a photo of their younger selves can be very helpful in that context.
Yeah. So when it comes to looking at their younger self and looking at their current appearance and how we can kind of turn back the clock, so to speak, we look at eyelids, we look at cheeks and necks and jowls and things like that to say, what is the potential for this surgery? It can be an eyelid surgery, it can be a facelift surgery, to say, oh, we get an idea of what we can restore, what we can bring it back to. And a lot of the times, this gives me an idea of um, kind of a priority list, I guess, of what features they want to change the most. For people who are older and now see a sagging or a drooping of their face, it can be like the neck bands, or it can be saggy cheeks and jowls like this, and then they point to that specifically in the mirror or on their face directly to say, I want that changed. So it's a good conversation starter, and it's a good way to gauge, hey, where did this beauty come from? And now that we're here, how can we continue the beauty journey to show some of that back again?
Yes, I see how that conversation may be very interesting for people. And even though it's not therapy, it could be therapeutic in its effect, because people can come back home, they can feel much better about themselves, and they can actually recognize certain aspects of their own appearance that actually is beautiful. And it's also
Mm.
good for you to know subjectively what is that person admiring about themselves, that you can maybe make sure that you preserve these aspects, and what are some of the aspects that really bother them to be and then you want to change them.
Yeah.
So let's talk about three procedures that you would say you like doing the most, and why.
As a facial plastic surgeon, the three procedures that I perform most commonly are eyelid surgery, rhinoplasty or nose job, and facelift. So, just in that order, eyelid surgery has become a lot more popular in the last 5 to 10 years, especially during COVID when we were wearing masks and all we
Hmm.
could see is each other's eyes. People wanted to show their most beautiful eyes. And even after the masks have come off, that still is a trend. So that's one of the most common procedures patients ask me to do, and it's upper and lower eyelid surgery. So with upper eyelid surgery, the main concern is extra skin, making your eyes look hooded, making them look heavy. And so that's a very common procedure that I do here in the office. With lower eyelids, it's a little more tricky because oftentimes what people talk about with their lower eyelids is that they have bags. And that can be the case a lot of the time. But if you zoom out and see kind of the way that the eyes and the cheeks meet, there's often the case where there's a loss of volume right around here, just under where people's eyelid bags are. And so, yes, we have to remove the hill of the eye bag, but also just below that, right about there, there's usually a shadow, and you have to fill that shadow with volume, and the volume comes from your fat. So,
So that's
um,
when fat grafting plays a role, right?
yes, exactly. So, a lot of the lower eyelid surgeries that I perform now, removing the eyelid bag is not enough. And so, over time, the sunken appearance that happens just along the margin of our eye socket is a common feature that we see. And if I don't address that, then you'll just look really, really hollow and skeletonized, which makes it look older sooner. So, yeah, vast majority of the time, I incorporate fat grafting into the lower eyelid surgery.
Do most surgeons do the same? You mentioned that procedure specifically, that one is something that not a lot of people specialize in, but I wanted to ask you, what is the reason behind it? Is it that the procedure is more difficult, or is it not as popular? Why not so many people specialize in that?
So lower eyelid surgery, I think, is trickier because gravity is less forgiving to something that's here compared to here. When you perform upper eyelid surgery, you remove the skin from the eyelid. It already makes the eyelid brighter, and it's a very forgiving surgery. You know, even if you remove just a tiny bit too much, you're still going to be okay in terms of the appearance, in terms of the outcome. With lower eyelid surgery, there's a couple more risks involved. I mean, I don't know if I need to bother you with the details of it, but suffice to say that, you know, if you end up looking like this and you see the white of the eye under your iris, that's a very bad look.
Of course.
Also, the strength of the lower eyelid weakens over time, so it's a little more likely to do that after surgery. So you have to be careful. There's just some, landmines that you just need to be mindful of when it comes to lower eyelid surgery.
Understood. Okay, so you mentioned the procedures. What is the reason why you like performing them?
With eyes, I feel like everybody's eyes are kind of like the second agent of your expression, right? With our mouths, we speak and we have smiles and frowns and whatnot, but with our eyes, we say a lot too. And oftentimes it's the nonverbals from our eyes that really tell the other person what we feel, what we're thinking. And so with regard to eyes, I think eyelid surgery is a very profound way to make a big impact on somebody's appearance.
Okay. And then what about the nose? Rhinoplasty. What is special in that makes you feel good about doing the procedure?
So there are many patients who seek out rhinoplasty. It's still one of the most popular plastic surgery procedures that patients have done in the US. The thing about my approach to rhinoplasty is that I make sure that the breathing is intact or better than before surgery. So there are several functions of the nose that you have to maintain or improve. And the one that people most commonly seek to improve is the aesthetic of it, right? That's one of the function of the nose, is to kind of tie together your overall appearance because it's at the middle of the center of your
For your
face.
face. Mm-hmm.
It has to be in harmony with your appearance. What can happen oftentimes in rhinoplasty surgery is that the structural components that help you to breathe well can be compromised, especially if you're making a bigger nose into a smaller, cuter nose. And so, you know, anybody can make a nose look good, but in the end, you have to make sure that it breathes well too.
Of
And
course.
so I always tell patients that because of my training exclusively in head and neck surgery, so just collarbones and up for the whole of my career, I had to be more mindful of that from the very foundations of my training. And so I say, if your nose looks good, but it can't breathe, I haven't done a good job for you. So every post-operative visit for every rhinoplasty patient, I always ask, how are you breathing? You know, are you breathing through your nose okay? Or is one side always plugged? You know, that's a concern for me as much as the appearance of the nose.
Of course. What about facelift? You mentioned, I wanted to circle back to facelift. Is there a different approach to facelift? Are there different ways that you perform the procedure? Or when people refer to facelift, it's always the same?
My staff say a lot of the people call the office asking for a mini facelift because they think they just need a mini change. And maybe it's my approach to things, but the one thing that I say about facelift is that mini will give you mini results and then you'll come asking for the actual thing later. So why not just do the actual thing now and enjoy it for a longer period of time? And for a very long time, the traditional way to do a facelift was to approach it from a top-down approach where we grab this connective tissue layer that we call the SMAS, and we reposition it to a more youthful position. But these days, and the more popular approach is to actually go under that smaz in a technique that we call the deep plane. And so what the deep plane does is it gets under the connective tissue layer and releases it so that when you reposition it to the more youthful position, which is kind of vertical and a little bit back, there's no pull on it. And so traditionally when people say, oh, look at that celebrity, they looked pulled after a facelift. This was back in the 90s and 2000s when deep plane wasn't done all that much. Now it's very hard to see patients who've had deep plane facelift surgery look unnatural. And so the idea is that this smaz tissue was once up here and you're just placing it there, and it's really not under any tension. So the myth of facelifts being pulled, that is even more so a myth now that I and other surgeons all across the world are actually doing more of the deep plane facelift.
That must be a really good feeling to see the patient coming after the procedure, and you see after healing has completed, the patient is happy, and you also admire your own work, even though it's somebody else's body, somebody else's face. It's quite amazing that you can also have all these masterpieces walking around and and carry your work. I wanted to tie it in with the soul of being an artist, because a lot of people don't know about you that you're actually a very accomplished violinist. You traveled around the world, performed. I know it's not really the professional path that you took, but it's the passion of yours, and you're extremely good. Because I sent for those of you who are listening, I wanted to let you know it's a good idea to check the YouTube channel and see the artistry in that violin performance. Because when I sent your track to one of the music composers that I know, and I said that we would like to do something with Dr. Kim's violin play, he said, no, you send me the original artist, but I wanted you to send me, Dr. Kim playing. And I said, no, that's actually Dr. Kim playing. And I verified with you. So I know you're very, very good. And the reason that is very relevant for plastic surgery is being an artist, you also are able to put a lot of emotions, and you also are able to put the years, the decades of experience of playing hours and hours and hours per day and practicing. You can also have the same muscle applied to practicing and looking for perfection in the surgical model. So I wanted to ask you how one helps the other.
Both violin and plastic surgery require a lot of hours of practice. And that's practicing the fundamentals. For violin, it's actually making the bow go up and down and making the note happen. It's reading the notes on the page to make sure all the notes are there when you play the piece. For surgery, it's the techniques of dissection, of suturing, of all of that. After you get a good grip on the basics, then it's how do you add your touch of artistry to that? Because my performance of a certain violin piece will be different from any other person's performance. And it's in the inflections, it's in the changes in tempo, the rubato, so we like to call it, where there's just that little ebb and flow in tempo that gives it that extra oomph. And the same goes with surgery. My deep plane facelift is going to be different from somebody else's deep plane facelift. And is one better than the other? Not necessarily. It's our flavor of how we help our patient's unique beauty go to that next level. So there's a lot of similarities, like you said, and I find passion in both of them. So it's really like, I've been playing violin for more than 35 years now. I don't know if I'll be doing surgery that long, but, just the number of hours of refining the technique, finding your own flavor and artistry, there's a lot of similarities there.
I can imagine. And thank you for sharing this. I think a lot of people do like your flavor, because otherwise
Thank you.
they wouldn't be coming and referring patients. When people come to your office, what are some of the things that you wish they knew about plastic surgery or about you before they come, but sometimes you have to explain them, and you're thinking about, I wish they knew about this, because it's obvious to you as a surgeon, but it's not obvious to them when they come. What are some of the things like that?
I think a lot of what we've been talking about in terms of, hey, you're already beautiful. So let's start the beauty journey with that foundation. Some people don't have that foundation when they first come to the office. It's the entire team's job to introduce them to that idea that, hey, you are here because you're beautiful. And some of the things that I tell patients, even the first thing I say when I meet them is, how can I help your beauty? I don't think many people have heard that from anyone, much less a doctor, right?
Yeah.
And
Sometimes they don't recognize that there is the beauty there to be helped, right?
yeah, yeah. And, another way that I will introduce it is, hey, if we do this, that, and the other, it will take your beauty to the next level. And so that statement also implies, hey, you already have some amount of beauty, and we're going to help you get to the next level. So,
Super.
yeah, that is one thing I wish that everybody knew, not just who come to my office, but also in life. I want to continue to get that message out there. The other thing that I wish people would know is they always ask, what's recovery, what's downtime? That's different for everybody. And, for some people, we kind of have to ask back, what does that mean for you? Is it, when can you go back to work? When can you go out in public feeling okay? When can you resume your normal exercise regimen? Things like that. So for everybody, that idea of downtime recovery is a little bit different. And so I'm probably going to make some more online content in that vein of, hey, what does recovery mean for you? In terms of this procedure, that surgery, what do you mean? And with regard to different aspects of life after that particular procedure or surgery, when can it come back to normal? So that's another thing that I want to elaborate further and have people have that in mind more clearly before they ever meet me. And then I think the third thing is, hey, how can I optimize my physical health prior to my beauty journey to help achieve the best results? And I think that's where, potentially elements of integrative health can help with that. Everybody is all about, going to a professional, getting a treatment, looking and feeling better, and that's the end of that. But what are you doing the other weeks and months between your visits? Are you optimizing your diet? Are you taking care of your health in other ways? So, one thing I say before surgery is, hey, eat some pineapple, because pineapple has an enzyme that's going to decrease the bruising during the recovery process. And a lot of people have not heard that, but it's something that is so low risk and is potentially very beneficial. So there are elements of our health and lifestyle outside of the traditional Western medicine that I think are really helpful in people's beauty journey.
That is very interesting. I didn't know about this. I knew that there is an enzyme in pineapple that is very helpful, but I didn't know it can be helpful in the context of plastic surgery. So I can bet that a lot of people hear it for the first time, and if it can help them, that is awesome. And also keeping that integrative lifestyle, integrative medicine, integrative healthcare component is also very important, because what are you doing in between to preserve that beauty? It's almost like you buy this new car and you have it, but if you don't take care of it, it's going to be just collecting dust and collecting bird poo and all that stuff.
Mm-hmm.
It's not going to look as appealing as as it was when you bought it. So, maintenance and helping take care of the body and pointing people to the right resources, I think is also very, very important. And I like that through all three of these, you're beautiful, you're unique, you're worth it. You're programming people for happiness. You make them feel good. And also knowing you off podcast, off camera, I know that you also have extremely good sense of humor and you love smiling. And
Mhm.
I wanted to ask you, how do you keep the balance between being serious, because people come to you with serious problems, and sometimes, like we mentioned at the beginning, they're emotional problems that really we are looking for this physical manifestation of physical solution to an emotional problem that can affect both.
Mm.
And you have a serious situation at the same time, you're walking around and you do want to uplift people, and I see there are some situations that you really have that sense of humor and your happiness really radiate from you. How do you keep the balance, because you want to be serious at the same time you want to show up as your true self with all the sense of humor?
I do like to keep a happy demeanor, because if you're not enjoying what you do, then you might as well not do it. That goes for me in terms of my own surgical performance. And I think it goes for the patient in terms of, their beauty journey. Surgery or procedures, sometimes they can sting a little bit, or they can hurt. Um, if you think about Botox, it's a needle, right? And so to help somebody overcome the sting of the needle, you need to have a good environment where people are happy, where the team is happy, so that we can exude that onto the patient. So I think it's a vital part of the patient experience here. The world can only be more beautiful if people are happier too. So I think I think that's the way I see it.
Yeah. So would you wait to inject or integrate that humor and more active happiness for your patient until after the consultation, or would you just adjust it, case by case and see who is walking through the door?
I think it's important for us to feel out the other person's sense of humor, their motivation for being here, but also kind of like, what makes them tick, what makes them smile. Because that's part of building the relationship. And the stronger relationship we have with the patient, the more successful the outcome.
For sure. And for those of you who don't know, at Dr. Kim's office, there is a really important additional manager, Nala, right?
Yeah.
This is Dr. Kim's dog, Nala. She's an office mascot and she is part of patient care as well. And it's
Yes.
so cool to see her, supervise everything and go from room to room. Such a tiny, amazing dog. And
Hmm.
this is the type of energy that I wish every office had when you walk in, especially if you walk in with a problem. You want to feel welcome, you want to
Hmm.
feel at home. And what's better than having a healthcare practitioner who will actually take care of you because they care about you? What's
Hmm.
better than having a healthcare practice and the whole team that is not looking at another rhinoplasty, another procedure walking in, but they know this is, you know, Monica, Karen, or
Hmm.
somebody walking in to the office and they look at the person and together they make you feel better. They tell you you're beautiful, you're unique, you're worth it, and they tell
Hmm.
you when they actually mean it. I think this is really great. This is the best approach to integrative healthcare that I can imagine, because you make patient the center of attention and you
Hmm.
also genuinely try to make them feel more beautiful. And coincidentally or not, this also helps the satisfaction of the outcome,
Yeah,
because after the
absolutely.
surgery, they are already looking for that beauty and now they can appreciate even more. They can
Hmm.
smile even more.
Yeah. The thing about it, and I think it's more important in plastic surgery than other medical specialties, is that since the outcome is very subjective, it's not like, oh, I removed a cancer, end of story, or I fixed somebody's back, end of story. beauty is on a spectrum. And so there potentially is no end point, if you will. It's how close do you get to that end point that determines how satisfied the patient is. And so, to that degree, having a strong relationship, a strong rapport with the patient before any procedure, any treatment, any surgery, I think is that much more important.
Of course, of course. And I know your patients feel this way. For people who would like to have more information about you, healthcare providers who would like to connect with you, refer to you, where can people find you both physically and online?
Physically, we are in Northern Virginia. Our current office is in Fairfax, which is about 30 minutes outside of Washington, D.C. Online, the best way to find me is through the website, jkimmd.com. I'm sure Mike will have the links. And also on our YouTube channel. I think the YouTube channel is a great supplement to all the more informational stuff on the website because it really digs down to who I am as a plastic surgeon, who the team are in terms of the experience that we're trying to give to our patients. There's informational content, there's mindset content, and we're always looking for guests who also help make the world a more beautiful place.
Super. Big thank you, Dr. Kim. And tell us one more question that I have for you. How can we as a group, you have healthcare providers here, you have some individuals looking for clinical solutions, evaluating providers, seeing who is good. How can all of us, how can we help you?
I think it's just a matter of, spreading the word. As much as we rely on Google and our online content, word of mouth is still very powerful. And I would say, when you look at conversions, even for patients who are referred by other patients, their conversion rates are way higher than for people who come just looking at Google reviews from people they don't know. Those are helpful as well, but referring from people that is a huge help.
Super. We'll definitely spread the word. Connect with Dr. Kim. Check out his office, check out his YouTube channel, watch some videos, ask questions, and remember that also a lot of people travel for plastic surgery. So even if you're in a different state and you are looking for a specific flavor of plastic surgery and you would like to have an artist evaluate your situation, Dr. Kim is very, very helpful. Dr. Kim, thank you so much. Have a wonderful day. Until next time.
Thank you for that, Mike. Pleasure.
Thank you.